Hello. Thank you for joining me. Today I will be going over two infectious diseases that affect cattle, specifically in their hoof area. The two that I will be covering are digital dermatitis and foot rot. I will be going over what each condition is, the mortality rates and any permanent effects that can happen, how it spreads, symptoms, diagnosis, treatments, and prevention. Initially, I had more conditions I was going to go over, but since the swine farrowing video was so long, I decided to severely shorten the script so that it wouldn't be around 20 minutes this time. And again, with the previous videos, I have pictures, and if they don't turn out too well on screen, I might end up editing them into the video afterwards. But they've seemingly been okay to view through the videos so far, so here's hoping that I don't have to change that up. So, digital dermatitis is a bacterial disease that usually affects the heel of the foot or the hoof, since this is a cattle that we're talking about. The disease is caused by bacteria from the genus Treponema, and there are 5 stages of digital dermatitis. Stage M0 being no signs and healthy skin. Stage M1 being early and subclinical stage. M2 being acute and active stage. M3 is the healing stage. M4 is a chronic stage that presents with hairy warts. And M4.1 involves a reactivating chronic stage. So, mortality rates and permanent effects. There's a low mortality rate, so you have a very good chance of your cow surviving if they end up getting this. However, if not treated in a timely manner and in an early enough stage, permanent hoof damage such as deep lesions and hoof deformation can occur. So in both these diseases, you want to be relatively quick about treatment. This disease is highly contagious. It can be spread via herd movement by introducing new infected cattle to a herd, or using contaminated or shared equipment that hasn't been properly cleaned or disinfected. Symptoms is going to be lameness. One of the telltale signs of digital dermatitis are these hairy wart-like lesions. You're going to have foul odor, and you're going to have a reluctance to walk, and you're going to have signs of discomfort. Sorry if you heard that. There's noises outside my room. So in both these cases, in both cases of these diseases, there doesn't seem to be an actual diagnostic test that can be done, like a blood test or anything. At least not what I found through the research that I've done for this. So there aren't any like tests that you can do. It's in both cases, it's mainly based off of observation of symptoms and a visual inspection and ruling out other conditions that it could be. Which is why there's some difficulty telling the difference between this and foot rot in some of the earlier stages, along with some other hoof-related conditions that I won't be covering. So treatments for digital dermatitis are topical antibiotics, sprays, and powders. They're obviously applied to a clean and dried area. There is a method that involves bandaging the hoof and the affected area, but it's recommended to leave the bandaging on for no more than 24 hours. So prevention, since the bacteria prefers dirty, wet environments with manure, it's important to keep environments clean and dry, and regular foot bathing with formalin and or copper sulfate is recommended. And so I have some pictures, and you can't really see it too well, but this is the hairy wart-like lesion that they're talking about. And of course you get other classic signs like inflammation and redness. But in the case of digital dermatitis, the hairy wart-like lesions are a major indicator. So in the case of foot rot, which is the second condition I'll be covering, it's primarily caused by, if I can pronounce this properly, Fusobacterium necrophorum, and that gets into the hoof, usually through a skin break or injury, and causes can be muddy, wet environments that soften the skin. Other environmental factors can be things like gravel or frozen mud that can cause injury to the skin as well. Mortality rates and permanent effects. Again, you have low mortality rates, especially when treated in a timely manner. However, untreated can lead to chronic and deep infections, which can potentially be fatal. And in some cases, they're severe enough, may require claw amputation. This is, again, highly infectious, and it, again, is spread through contaminated environments, similar to digital dermatitis. Symptoms are going to be sudden lameness, usually in one limb, swelling of tissue between the claws. So you're going to usually get swelling and signs of inflammation in this area. Foul smelling and necrotic tissue between the claws. The area in between the claws can also be referred to as the interdigital space. So if you hear that term, or if you see it while doing research on hoof-related issues, just know that they're talking about the same thing, which is in between the claws. So another symptom is split or cracked skin in the area, reduced appetite, and of course inflammation and redness. And you may also have your cow may also have a fever. There is no official type of testing, so similar to digital dermatitis, it's not like a blood test that you can get. It's mainly observing symptoms and ruling out other conditions. And treatments are dealing with cleaning the area, of course, topical antiseptics, systemic antibiotics like oxytetracycline or penicillin. And if you are quick to treatment, recovery can be in as little as 3 to 4 days. However, delayed treatment may require claw amputation, as I mentioned, and that's if the infection gets deep enough into the hoof. And prevention is, again, dealing with environmental hygiene, so making sure the environment that your cows are in is clean and dry. And it also recommended that you make sure that your cows have enough zinc in their diet. And this is a picture this way? This way, or I'm not sure. But you can see that there are obvious signs of infection. The colors are kind of muted, but you can see that some of the tissue is looking like it's necrotic, and that's usually signified by like a grayish colored tissue, because it doesn't have any blood flow. So those were 2 conditions that affect cattle hooves. And I hope you were able to learn something from this video, and I appreciate you for joining me. Thank you.